The voice of a woman is firm, but gentle, calm, and boisterous, soft, and powerful. A woman's voice can plant and build, make and shape, whether a whisper or a wail. A woman's voice is the future. The high number of maternal deaths in Nigeria has been a public health concern. According to the World Health Organization, Nigeria accounts for 20% of global maternal death. In Nigeria, for every 100,000 births, there are 512 maternal deaths. Nigeria Demographic and Health Survey 2018. Some reasons that contribute to this maternal death are postpartum hemorrhage, which is a severe bleeding after childbirth, sepsis, high blood pressure during pregnancy, preeclampsia and eclampsia, unsafe abortions, complications from delivery. When women were asked what they wanted from maternal and reproductive health care, their responses were documented in a report called What Women Want, produced by White Ribbon Alliance, a global alliance of maternal health advocates. The report showed the importance of integrating women's voices in their maternal health decisions. The top demands of women were respectful, dignified and non-discriminatory care, increased competence and better supported health workers, including midwives and nurses, increased closer functioning health facilities with water, sanitation, and hygiene.
So I'm going to give an overview of the RICOM 3 project. First of all, RICOM 3 means reducing the indirect causes of maternal morbidity and mortality. So this project was actually started or implemented in Lagos State and the FCT in 2 local authorities in each of those states and 40 health facilities cutting across general hospitals, PHCs and private hospitals as well. And we implemented a model of care, women-centered quality of care model, and implementing partners were JAPIGO, MDOC and HSDF. So this actually started before the project kicked off, because it was important that we use the voices of women to actually design the quality of care model for implementing the RICOM 3 project.
RICOM integrated quality of care model that took a holistic approach from engagements with the healthcare workers at the facilities to community engagement to direct engagement with the women. So we gathered women's voices through various methods, through our review system on NaviHealth, the AI platform, through interactions with, virtual health coaches, through interviews at the in-person tech-enabled Nudge Hubs, through our online community, through community outreaches. We also conducted a pricing analysis so that we understand women's willingness to pay for certain features. All this helped us to, really understand women's experiences, their concerns, their priorities, and help, ensure that the interventions were responsive to women's needs.
Why Are Women Dying While Giving Birth in Nigeria report was developed following a 12-month community-informed maternal death review. It was conducted as Nigeria Health Watch and Consortium in 6 different states in 2019. And we aim to provide an inquiry into the reasons why women were dying, pregnant women were dying in communities in Nigeria, and to propose an accountability mechanism to ensure the maternal deaths in communities are actually counted. Some of the recommendations from the review emphasize the role of community leadership, collaboration being very important in facilitating community maternal death survey response, as well as ensuring that in the communities we actually worked in, that primary health care was made available to women when they needed it. When women's voices are not listened to, there could be some serious negative consequences. You can imagine a pregnant woman is in labor, she's about to give birth. Nobody believes when she says that she's in pain and needs help. That can have an adverse outcome on her experience when she's giving birth. During the Giving Birth in Nigeria project we conducted, there were many lessons learned, and I can categorize them or summarize them really and highlight them in 3 different points. First of all, women stated that they want to have more female health workers in health facilities. You know, in Nigeria, cultural taboos dictate that husbands do not actually want their wives to be treated by male health workers. So first of all, we need more female health workers. Next, access to health facilities. In some of the areas we went, they were riverine, they were far from health facilities. We know in Nigeria we have poor road networks, and sometimes women don't even have transportation to take them to a health facility. So what they need is they need to ensure that they're able to reach a health facility and have access to skilled care when they're giving birth. And third, women stated that they experienced a high level of anxiety when they were pregnant, which meant they had little support, there was very little mental health care when they were pregnant, and so this was never addressed whenever they went for antenatal care or postnatal care. And these are some of the very important lessons we learned from actually listening to some of the things that women said when we were doing the maternal death review.
It is important, if you want to provide quality of care as a healthcare worker, that you're not just thinking about yourself and what you should be doing, but what does the woman need at the end of the day. For policymakers, if you're just going to sit around with your likes and set out a policy without actually involving those that you're doing the policy for, then that policy will not be effective.
Respect and dignity is of the utmost importance to women.
Hear what they want, understand their needs, and incorporate these in the needs and their policy design and the decision making. In addition, for them, they really want health workers to be intentional, paying attention to what they're saying. By listening to them, then it means that their needs are provided for. And what does this really mean? It means they have safe, effective, patient-centered, timely, efficient, and equitable healthcare. And lastly, women just want respectful care. They want to be treated with dignity when they're giving birth.
When we listen to her as a mother, a friend, and a sister, we can imagine a world where the voice and experience of a woman can bring about great change, shape policies, improve health, and save lives. We can imagine a world where no woman has to die giving birth.